Welcome to Petgevity, the podcast that gives you the best advice to help your pets live longer, healthier lives. As a vet, I've worked with a huge variety of unruly animals: tarantulas, iguanas, and a whole host of sharp, beaked troublemakers. If it's got a mouth and likes to bite, chances are I've treated it. However, in all my years in practice, there's one animal, one creature that strikes more fear into me than any other. Cats. And I'm not alone in this. A recent viral video from a South African vet takes it a step further, suggesting that the main culprit of veterinary terror is in fact ginger cats. Today I'm joined by animal behaviourist and the founder of Veterinary Behaviour Support, Dr. Sophie White. Together, we'll explore whether certain breeds are more prone to aggression, why pets can turn troublesome at the vet, and what can be done to make your next visit calmer and more comfortable for everyone involved. Hello, Sophie. Thank you for joining us and welcome to the Petgevity podcast. We're going to start with some very quick fire questions and I would like you to give just yes or no answers. So, are you ready?
I am.
So the first question is, are certain breeds more likely to be aggressive at the vets?
No.
Second question, can a certain medical issue cause pet aggression?
Yes, definitely.
And then, can pets give consent to be treated?
Yes.
And then my last question is, what is the biggest misconception about aggression at the vets?
I think that's probably going to be that how our pets react to the vets is a really good representation of how they are in real life. And that's often not the case.
That's a really good answer. So we've both worked at veterinary practices. So I'm sure we each have many stories about behaviourally challenging or quote unquote intimidating pets. I remember one particular case of I had a cat come in from a rescue centre and it managed to escape. And one of its skills was climbing the walls, the plastered walls, by digging its nails into the walls, very much like a Spider-Man scene, much to everyone's horror. But the reason this topic has come up is because of a trending conversation that seems to be floating around right now, which is suggesting that the number one troublemakers at the vet are specifically ginger cats.
Yep.
So, our trending pet question today is, are ginger cats more aggressive at the vet than other colours? Or is that just a myth?
Actually, if we look back a little bit, we can probably both recall a time when it used to be, naughty torties. So the saying used to be that tortoiseshell cats were the naughty ones, they were the troublemakers. So I think maybe gingers are now just getting the bad rep. If you do surveys and things, yes, they might come out as being overrepresented in that way. But I think when we actually really look at, is there any reason they would be, or is there actually any solid evidence to suggest they are more likely to be aggressive or kind of cause trouble, so to speak? I very much doubt that there's a good solid basis for that. We know that behaviour is linked to genetics, and genetics aren't irrelevant, but we also know that certainly when we think about breed, that is not a good indicator of behaviour. And colour is not going to be a super reliable indicator of behaviour either.
I mean, I grew up with Rottweilers and I grew up with German Shepherds, and, these breeds often get labelled as being aggressive. Why do you think that is? You've just shared that there's a bit of a weak connection. So why do you think that happens?
It's a really good question. It's a really important one. And I think there is very complex reasons as to why certain breeds get a bad rep at certain times. Because as you say, XL bullies are kind of poster child for dog issues at the moment, unfairly so, but they're the current ones. And like you touched on, certainly we're probably a similar age. And when we were growing up, it was the Rottweilers and the Dobermans and then the German Shepherds, and then it was the Pit Bulls, in the 90s. There's lots of reasons behind that. And when we look at safety around different breeds of dog, breed is important because they're very different physically. And obviously a German Shepherd or a Rottweiler that bit with full force would do a lot more damage than a Chihuahua. But that doesn't mean they're more likely to bite you. And it also doesn't mean that they would use their full capabilities if they were to bite you. I think you could probably talk to lots of people who've been bitten by a large dog who actually weren't seriously injured. And equally, I remember having a little Yorkshire Terrier on the end of my finger that it wasn't a bad injury, but it did a pretty good job. It left some nice little punctures in the end of my finger. And, there's lots of factors that come into the safety around different breeds and around the way they express their feelings and behaviour. And breed, like I said, breed isn't totally irrelevant because size and physicality matters when we think about risk. But that's not the same conversation really as whether or not they're likely to use aggression.
I think that's a really good point because, in my practice, I've seen, I have a small Lakeland Terrier, for example, and he's not always the most amenable.
Yeah.
But because he's smaller and his stature is smaller, he gets a little bit of off scot-free, most definitely. So I completely agree with that distinction. Is there a good predictor of pets' aggression levels then? Is there anything else out there we should look for?
Previous behaviour. So past behaviour predicts future behaviour. So obviously we all change and it depends on our environment and our situation. But knowing what your pet has been like in the past gives us a pretty good idea of what they're going to be like in the future. We also need to think about, like we touched on genetics and we said, maybe breed isn't that helpful. But what is helpful is what were their parents like and what were their grandparents like. So when we think about where we get our dogs from, and selecting puppies, for example, that's why it's so important to know about their parents and their grandparents. Their close genetics is more important than what breed they are.
Just pivoting away from that because, seeing how dogs are at the vets, it's only a snapshot.
Yeah.
And one thing that I've always asked is, why is it that clients are able to say that their dog is wonderful at home and then they come to the vets and they're so different? Why might that happen?
It's such an unusual environment in the vets. They are in a new place. They're with new people. There's other pets around, not just dogs, but there might be loads of other animals around they can hear and smell. There's those weird smells. There's chemicals and other animals like stress signals and pheromones and stuff they're giving off. There's often weird noises. There's just so much strange stuff just in the environment. And then we're having a really weird interaction from those animals' perspective. There's not many other situations where they'd just walk into a room and someone would sort of start examining them and like poking and prodding and expect them to stand on a table. There's so much that's unusual, but also a lot of our pets will have prior experience at the vets. And unfortunately, going to the vets is usually not a particularly fun experience. You normally go because you don't feel very well or something hurts, or they do something to you that's quite weird, hopefully not too painful, but might be quite odd. If last time you went, someone poked something up your bum, you're not going to go and be like, oh, this place is amazing. You're going to think, hang on a second, they might be about to do something weird again. That's going to change how you perceive things and how you behave. It's not going to be the same as when you meet someone at the park who normally says hi to you and, gives you a biscuit. All behaviour, but particularly when we think about aggression, is communication. That's all it is. And as you say, if you feel very differently about environment and you're feeling quite overwhelmed, you're going to perceive things differently. You might perceive something which normally you might think, oh, that person's like reaching out to touch me. That's not so bad. When you're at the vets and you've got all those other stresses and you say previous experience in that environment, you might suddenly think, actually, I'm not sure that is okay. I think I need a bit of time, or I think I need a bit of space, or I don't want them actually to touch me. And they can only express that with their behaviour. So that's when you might see them, barking or growling or doing whatever it is they do. They're trying to get that point across that, what do they need? Probably a bit of space.
It's great to have a deeper understanding of aggression because it's such a big part of our jobs. It's also great to have insight about what it's telling us because people kind of have this binary approach a lot of the time. So thank you for that. I want to move on to how this behavior might affect your pet's health. Would you say it's fair that some pets are not being taken to the vet because their owners are worried about them being aggressive?
Yeah, definitely. And I think, there's two sides to this, isn't there? Because there's then how does not going to the vets affect your behaviour? But when we think about how does your behaviour affect your ability to go to the vets, that's really important, because we know that having a pet that has challenging behaviour is a lot for families to take on. It takes up a huge amount of sort of energy, sort of emotionally. A lot of what people often discuss with me is the fact of how judged they feel. And they really worry about people's perception, both of them. They feel that maybe people might think that they're irresponsible, or they're not doing anything, or not trying to do anything about their pet's behaviour. But they also really worry that their pet is judged. These are their pets that they love. And they think that, everyone thinks they're horrible and nasty. And, I worry I'm going to go to the vets and they're not going to care about him, or they're just going to try and get him out because he's really difficult there. And I think actually quite a lot of people also worry about safety. They feel worried that I'm going to take them to the vets and it's going to be really awkward. It's going to be really embarrassing. And what if they bite the vet, or, what if something happens? Understandably, that makes them less keen to go. And that's a real shame, because the clients aren't then getting the support and guidance that they could be. And also our pets are not having as much access to care and medical care as we would like them to be.
What medical issues causes or can contribute to aggression in people's pets?
Contributing is probably the most common. You will occasionally see very direct association, like there is this thing wrong and therefore they are using aggression. But normally it's lots of contributing factors. And certainly my experience also tends to reflect the research on it. There's quite good research on health issues that are more likely to encourage aggressive behaviour in animals. And probably our number one is going to be pain, which obviously could be from lots of places. The most common is going to be musculoskeletal pain. So we know, unfortunately, that our current pet breeding is not conducive to good musculoskeletal health. We have lots of arthritis in young animals. We have lots of congenital deformities which cause pain in the muscles and the bones and the joints and spines, etc., of lots of our animals. So pain has a really big impact on how you're likely to behave. Also, another really common one that people don't always think about quite so much is gut health. It's very, very common to see pets with chronic gut issues. So they might have food allergies, they might have IBD, they might have sort of chronic reflux, particularly for some of our brachycephalics who struggle with reflux because of their anatomy. Those things have a really big impact on how they feel. And like we know in humans, and we're starting to know a bit more in animals, our gut microbiome is really important. So if our gut's not happy, that's going to impact our behaviour. Another one that we do see quite often, and again, I think is probably underappreciated, but is a big problem in general practice, is skin. So again, our skin health, ear infections, itchy skin, we know that those things also contribute to maybe a propensity to show aggression. They're going to change how you feel if you're itchy and feeling a bit grumpy.
With particular breeds, it's almost that the breeds themselves aren't the issue, but their predisposition to certain conditions can then direct them into things which manifest in aggression.
I think that is a really good point, and I think that's something we don't always think about so much, but it's something that was raised, I think, by quite a few people in the industry when we were looking at reasons why we might have seen increases in instances of aggression towards people in certain breed groups that have then obviously led to changes in legislation. There's lots of factors, but one of those we have to consider is actually those types of breeds are also very prone to things like hip dysplasia, a lumbosacral disease, skin issues. We know lots of our bullies, bless them, are sensitive little souls, and they are very prone to having allergies and all sorts of, upset tummies and itchy skin and ears and everything else. And then again, when you think about some of our really classic breeds, I know this is certainly not my opinion of the breed, but I think when we think about breeds that we always used to think are quite tricky in practice, Shar-Peis always used to come up. The Shar-Peis always used to be like, oh, they're always really grumpy. Oh. And I always just used to think, well, wouldn't you be? Like, if your eyelashes were scratching on your eyeballs and, you know, your ears were so narrow and everything else, the Shar-Peis, obviously, that were coming into us normally were poorly. And they are a breed, unfortunately, who do have so many issues. It's not really a surprise. They might be a bit grouchy.
Us as humans can have so much bearing on the emotions of these animals that ultimately kind of get handed, you know, a bit of a rough end of the stick, genetically speaking. So does a pet getting aggressive, shall we say, at the vet mean the owner has failed to attend to them properly?
No, not at all. And there can be, and it's not the same for every pet, but certainly I work with quite a few pets where their families, their owners, their guardians can do anything with them at home. Like, if you show them to put their ear drops in, if you showed them how to vaccinate them, they can do all of that. They just are like, you stranger or you vet are not touching me. But, you know, at home, mum and dad can do whatever they want. Equally, there are some pets where actually it's the handling that is the issue, and they might actually not really want anyone doing too much to them. So it does really vary. But there are some animals, you say, where it is super specific to the vets. And families are not always going to know what to do. They need to know where to go to get help and guidance. And we need that to be accessible to people so that they know what to do, because they are things that you can improve. And it's not to say you've done anything wrong. You know, there are lots and lots of factors that add into why your pet might find that environment difficult. And I don't think it's unreasonable for them to be finding it difficult. So I think what is important is that if it's, you know, if we become aware that there is a problem, we want to be looking at what can we actually do about it. And I think as responsible, you know, pet owners and pet guardians, we do need to be thinking, what can we do to try and make this easier for our pets? What can we do to try and make this easier, you know, for ourselves and for the vet staff, so that we can make sure those pets do get good care once we know there's a problem?
I really would like to focus on how to make vet visits as stress-free as possible. So first, I'd like to go back to something that you said in the quickfire questions at the start, that the idea around consent. And like, you know, it was very good because you paused for a second and how to respond to that. So just from your side, what ways, I guess, can a pet or a being or an animal give consent?
The reason I paused was because there has to be some preparation. So if we're just at the vets and an animal who hasn't got any prior learning or experience in consent is suddenly given the option to say, like, oh, I don't want to do that, they might not know that's an option for them. So it's not to say that we can just immediately start expecting our pets to understand the concept of consent, but we can teach it. And when we think about consent, a lot of it is very transferable between people and animals. We just have to put some caveats in. So informed consent is an area that we sometimes struggle with animals, because it's like, well, how do we tell them what we're going to do? And the first time you do something, obviously they're not going to know what it is because they don't understand you telling them. But they will understand if we follow the same routine and the same pattern, they will know what comes next. So if we have a pattern of how we do something, they're going to know what's coming next, and they can then choose, if we allow them to, they can then choose to opt out and be like, oh, I know what's coming next. I don't want to do that. But we have to give them the option to say no without using aggression. Because if they can't opt out, that's when they might say, I really need you to stop. And the most reliable way of doing that is maybe by, you know, showing my teeth and getting the teeth involved. That's probably going to stop you. We would like them to be able to say, oh, I don't think I'll do that. Let me just, you know, walk off over to that side of the room and remove myself. There's a concept called cooperative care, which essentially is consent-based husbandry. So using consent-based activities to allow for sort of the care of our pets. So that might be grooming, that might be going to the vets, that might be, you know, doing their spot-ons at home or whatever it is, which some of our pets are still like, no, thank you. And ultimately, it comes down to providing choice. And actually, we already use this a lot in other areas of veterinary medicine. So zoo medicine is obviously quite a tricky area because those patients generally have very big teeth and we often can't even touch them when they're conscious. Like we have to be behind, railings and everything. And also we might have patients in zoo medicine where we don't really want to be sedating them either. That's much higher risk than it would be sedating a cat or a dog. So we need to think about how do we get them to partake in their own care. And zoo medicine has very much led the way there because we have some amazing animal trainers that work in zoos who can show us that if you can teach a polar bear, to show you its teeth and, to present its bum so you can inject it through the bars, we can definitely teach our cat and dogs, to do a few things. But it comes down to helping our pets understand what will happen at the vet. So they need to have predictability. They need to know what we'd like them to do. And they have to have the choice to say no. Because if something's scary and you know that you can't get away, that makes it so much worse. Whereas if you can say, hang on a minute, I just need a second, you're much more likely to be willing to partake in it.
What's really beautiful to me is that it's clear that the words you're using, almost like you said, is almost transferable from humans to animals as well. There's a lot of crossover here. And, coming back to zoo animals, obviously that's my area of leaning or tendency typically. But in these situations, as you've mentioned, where consent, is something that we have to learn, when is sedation a good option? Because it's something that I lean into at work because I'm very against, kind of holding animals and stressing them out. And there's obviously a time and place. So from your perspective, when is sedation a good option and when would you resort to that?
I think that's a really good point. And I think one of the things we have to come back to and think about there is the thing that we're trying to do. So that procedure we're trying to do, is it a nice to do or a need to do? So is it something that at some point I really would like to be able to, maybe get a blood test to do a vaccine titer, for example, which lots of clients might want to do, which is great, but we don't have to do it. There are alternatives. For something like that, we would ideally want to plan in advance and find alternatives that are within the animal's ability to cope with. If we have a situation where, for example, one I come up with quite often is we have animals which we think are painful, we need to work out a treatment plan, we might need to get x-rays on them, or another one that comes up quite a lot is animals that really cannot be groomed. They're very matted. And we think, actually, we just need to get this coat off and start from scratch. Sedation is a great, great option as long as the patient is sedated or anaesthetized to the point that they are not aware of what's going on. So sedation, just as chemical restraint, so just as stopping them moving, can sometimes be used to make it easier for us to do the job, but that doesn't always help the patient because they might still be aware of what's happening. And that's not necessarily going to help them because that's going to be a really scary experience. But if essentially they can have an injection and, drift off to sleep and then wake up and be like, oh, my hair's gone, then brilliant. They've missed all the scary bit. And that will then help us move forwards. We again want to think about, right, well, next time, what do we want to be working on so that next time, ideally, we don't need to do that. Everyone's capacity is going to be different. So there might be some animals where you think, oh, we would get to a point where we don't need to sedate them again. It won't take too much, maybe this time, and then we should be able to do it better next time, maybe with some medication before they come into the vets, for example, to kind of take the edge off a little bit. Whereas there are some patients where we think realistically, if we need to empty your anal glands or if we need to look in your ears, we're going to have to sedate you because that is way, way outside of their comfort zone. And even with lots of training and support, everyone has their limits. And there are going to be some patients who some things are just always going to be too much for them. And if they need to have them done, we don't want it to mean that they just don't get it done because it's something they're not comfortable with. If we have to use sedation to do that, then that's fine if that's actually better for their welfare overall.
Outside of sedation, what else can you do at home or we do as clients to make our pet's experience calmer at the vet?
So I think thinking about what are common things that come up. So If we have a pet who we know might have a tendency to utilise aggressive behaviours at the vets, it's really common that the vet staff might ask you if they can put a muzzle on your pet, which is very reasonable because, of course, we don't want anyone getting bitten. But having a muzzle put on when you are not used to it can make it even scarier. And being muzzled doesn't change how you feel or change your tendency to show aggression. You're still going to try and bite people. You just have a muzzle on for safety. So a muzzle is certainly not going to fix the problem, but it can be a really essential step in safe treatment. And if you could help your dog be comfortable wearing a muzzle, ideally having a muzzle that fits them really nicely, that they're used to and comfortable wearing, if they can go to the vets and they're happy to put that on or go into the vets already wearing it, that's going to make their visit and from the vet's perspective as well, so much easier than having to try and get a muzzle on at the vets when they're not used to it.
Absolutely perfect. That makes a lot of sense, especially, seeing it day in and day out. The rigmarole and the back and forth when you're trying to find the right muzzle. It's a very stressful experience, most definitely. My last question would be, what is your top tip that someone can do tomorrow to make vet trips stress-free?
Open up a dialogue with your vets. And that might lead you to the decision that there might be a practice that maybe suits you and your pet's needs better. Or hopefully what that will mean is that they will be able to let you know what support they've got available. Quite often our vet nurses have a really big role in helping support our patients that find it a bit tricky and their families. In terms of building confidence at the clinic, etc. But there is always going to have to be forward planning, and there is always going to have to be kind of preparations and work put in. And I think good communication is so, so important. So I think start that conversation. If you can speak to your vet practice and say, the last few times we've been in, it hasn't gone very well. We want to make it better next time. I think that's got to be a great starting point.
That's a wonderful answer. Thank you very much for being here today, Sophie.
No problem at all. Thank you for having me.
Thank you for joining us. I'm your host, Fabian Rivers, and this podcast is brought to you by Petgevity. If you'd like to find out more about how we can help your pet live a longer and healthier life, the link is in the show notes. This podcast is produced by Flamingo Media. Thanks, and see you next time.